How are you doing this morning?
Good, thanks.
Good. All right, Miss Betty, we're going to do a full assessment on you this morning, okay? So just follow my directions and just follow my instructions and we'll get it done.
Okay.
All right, this morning I'm just going to look at your head and I'm just looking at the color, the temperature, looks appropriate for ethnicity. Moisture looks good. Your makeup looks beautiful. Smooth texture. I don't see any swelling in the face. Your skin trigger is appropriate. No bruising. You had any problems with anything in your face?
No.
Okay. I don't see any scars or lesions. Do you have any scars on your face?
I have an old one from when I fell as a little kid right here.
Okay. I'm just going to look at your face for symmetry, and it looks wonderful. Looks very symmetrical down the middle. All right. I'm just going to touch your head this morning and just checking for any lesions or masses. I don't feel any. Have you had any scalp problems here recently?
No.
All right. Your hair feels smooth, evenly distributed. Any balding problems?
None.
All right. Wonderful. Shh. All right. And no problems with lice or anything like that ever, right?
Nope.
All right, wonderful. Alrighty. I'm just gonna touch your temples right here. You have any tenderness right there?
No.
All right, I don't feel any masses. All right, I'm gonna do your lymph nodes. We're gonna start with the preocular. All right. Okay, and then I'm gonna do the postocular. Occipitals. Maxillars. Any tenderness or pain at any of these spots?
No.
Okay. Any here?
No.
Alrighty. Alright. Any here?
None.
Okay. And any here?
None.
Okay. Wonderful. Wonderful, wonderful, wonderful. Alright. I'm going to have just go right here and I'm going to have you just clench your jaw like this. Wonderful. That looks good to me. Alright. And I want you to close your eyes for a second and just tell me where you feel a light touch at.
Left cheek. On my nose. On my forehead. On my chin. On my neck.
Alrighty. And then this one, can you smile for me? Alright, and frown. Okay, and do your mouth like this. And then poke your lips. And raise your eyebrows. Alright, wonderful. Wonderful, wonderful, wonderful. Alright, I'm gonna look at your ears. I'm just looking at them to make sure they look symmetrical. No tenderness. You don't have any earaches? Have you had any earaches recently? No. Wonderful. Alright, if I had an otoscope, I would look in here. I don't see any drainage or redness. And I would check the light reflex in both ears. However, I do not have an otoscope this time. They look wonderful. Alrighty. And then I'm just going to check here. Touch your ears where your earrings are. Alright, and then I want you to cover your right ear, and I'm going to whisper something on that side, and I want you to repeat it to me.
Okay. 47.
Alright, and if you could do the other ear, and I'll repeat it a different number to your ear.
62.
Wonderful. Wonderful, wonderful, wonderful. Okay, and then I'm going to get my tuning fork out. I don't have a real one this morning, so we'll just be using our kitchen fork. Alright, and I'm going to place this on your head. I'm going to hit it. And you just tell me how, as long as you feel it.
Yes, I feel it.
Okay. Do you feel it on both sides of your head evenly?
Yes.
Alright, wonderful. And then I'm going to place it right here behind your ear, and I want you to just tell me when you stop hearing the noise.
Okay.
Alright. And do you hear it again now?
Yes.
Okay. Wonderful. I'll keep this around in case we need it again. Alright, let's take a look at your eyes. Do you wear any contact lenses or
No.
glasses?
I do wear glasses.
All right. You have any? Your eyes look a little red on the right side. Do you
Yeah.
have any allergies or
I-
irritation there?
I do. I'm allergic to dogs.
Okay. Do you use any eye drops to treat that?
I try to, yes.
Okay, and look all the way up for me. All right, and then I want you to follow my finger, just your eyes, okay? Wonderful. I'm gonna go grab my pen light. I'll be right back.
All right.
Alrighty. Just look into my pen light for me. Alright, the pupils are round, black, about 2 centimeters. Alright, and then when we come in from here, and they evenly constrict, and they're accommodating to light. The sclera are blue-green. Sorry, the cornea are blue-green. And the sclera are white with a little bit of red in them this morning due to some dog allergies. Alright, then we're gonna take a look at your nose. Have you ever had any problems with your nose?
No.
Alright, wonderful. Looks very symmetrical. I'm gonna palpate your sinuses here. Do you have any tenderness?
Nope.
Alright, how about here?
No.
Alright, wonderful. Alright, and I'm gonna use my pen light again here and just take a look in your mouth. Could you open your
Sure.
mouth for me? Alright. I see we've got some cavities that are in there from previous surgeries.
Fillings.
Okay, fillings, there we go. Alright, the hard palate and tongue are pink. The lips are appropriate to color. Can you lift your tongue up? Wonderful. Under the tongue is pink. The teeth look good. The gums are good. Do you ever have any bleeding gums? Any problems like that?
No.
Wonderful. Any toothaches or problems like that?
No.
All right, that's great. Wonderful. Alrighty. And I'm just gonna open up for me one more time. I'm just gonna look at your tonsils. And the tonsils are normal, not inflamed or swollen, and they're pink. All right. And then I'm just gonna start here. And can you just open and close your jaw for me? There you go. Good. Wonderful. And that was good. No TMJ there. And then, can you just give me a sentence. Can you repeat after me?
Sure.
The dog walks at noon.
The dog walks at noon.
Okay, and that's C9 and C10 are in good tact. The tongue is midline. And can you just swallow for me?
Sure.
And the patient is able to swallow, so that's appropriate. All right, and then we're just gonna check the neck again. I'm just gonna look at your neck. We're gonna look at the color. All right, I'm gonna test skin trigger as appropriate. Weigh less than 2 seconds. Texture, smooth, no edema. No bruising, scars, lesions, or neva. Okay. The trachea appears to be midline. Swallow for me one more time. All right, perfect. I'm gonna palpate your thyroid gland. All right, and it's not palpable, so that's normal. All right, and then I'm gonna check your carotid right here. Okay, I'm just gonna listen to it for just 1 second. We're gonna check for bruise and make sure we don't have anything going on there. All right, and no bruise is present. All right, Miss Page, I'm gonna have you turn your neck. I'll just tell you the direction. I'll demonstrate and you follow after me. Down, all the way back, all the way to the right, all the way to the left, full circle, and then back and forth. Any pain or tenderness when doing that?
None.
Wonderful. Alrighty, and then I'm gonna have you shrug your shoulders just against my hands. There we go, strong. That's wonderful. Alright, relax. Alright, and then I'm gonna have you sit up just for a minute and I'm gonna take a look at your back.
Okay.
If you don't mind taking your sweater off just for a minute. Okay,
On this side.
that's fine. Wonderful. What a beautiful sweater.
Thank you.
Alright. Alright, we'll just do it like this. Okay, and just take some deep breaths for me. All right, the skin looks good back here. We've got a few moles and freckles present on the skin. I don't see any signs of respiratory distress or anything like that, no flaring. Chest expansion is symmetrical bilaterally. Alrighty, and then I'm just gonna take a listen to you and I'm gonna ask you to say a few different numbers.
Okay.
Alright. You say 99 for me?
99.
Alright, and say it again.
99.
Again.
99.
And one more time.
99.
Alright, and then I'm just gonna sit down with you and I'm just gonna listen to your lungs. So just take a few deep breaths for me, okay? Good, just a few more. Last one. All right, and then I want you to say E, E. Alrighty, and then can you say 1, 2, 3 for me?
1, 2, 3.
All right, and then I'm gonna have you whisper 99. Perfect. All right, sounds wonderful. And then you're welcome to put your sweater back on. All right, and then I'm just gonna look at the chest expansion and I'm gonna listen to your lungs on the front of your chest just for a second. I don't see any signs of respiratory distress. The skin is appropriate to ethnicity, no redness, swelling, or bruising. I don't see any nasal flaring or any signs of that. All right. Will you just go ahead and say 99 for me again?
99.
All right. Again?
99.
Alrighty, and I'm just gonna listen to your lungs and take a few deep breaths for me. And one more. Thank you. Thank you. All right, Miss Paige, we're gonna take a listen to your heart this morning, okay?
Okay.
So all you need to do is just sit still and I'll take a listen to you.
Okay.
I'm gonna listen to all 5 spots: aortic, pulmonic, Erb's point, tricuspid, and mitral.
All right.
All right, and this is going to be the point of maximal impulse for this patient. And I'm going to go ahead and listen to the heart rate for 1 full minute, starting now. Just a few more seconds. Alrighty, perfect. Had a heart rate of 82 with a normal sinus rhythm. All right, Miss Paige, and if you don't mind, I'm gonna have you come over here and just lie down just for a moment. Sure. Transition. Look at that. Wonderful, thank you. Alrighty, and I'm gonna inspect for any heaves or lifts,
Okay.
and I don't see any. Alright. And then I'm just gonna be taking a listen to you in a few more places. And I'm just gonna take a seat down, okay, alright? And I just listen for any bruises or anything like that. Alrighty, all sounds good. And I'm gonna take a listen to your heart one more time. Lie down. Alrighty, all sounds good.
Okay.
And then I'm just gonna put you up just a little bit. Just go and sit up just a little bit. Just about right here. I'm gonna place these pillows behind your back.
Alright.
You can stay laying down.
Okay.
Alright, that's perfect right there. I don't see any jugular vein distension in the neck or anything like that, so that's great. Just observing one more time. No jugular vein distension. None seen. Perfect. Alrighty. Then we're just gonna take a look at your stomach this morning. Alrighty, and I would say that the temperature is warm, that the skin is appropriate to color, no distension, no swelling present. I'm just gonna go ahead and take a listen to you this morning. Just take a listen to your stomach. I think that it's moist, the temperature is appropriate, no lumps. Any tenderness here?
None.
Okay. I'm gonna go ahead and palpate the liver while I'm here, and it's non-palpable. And I'm gonna palpate the spleen, and it's also non-palpable. And I've already previously, I just listened to the bruits and didn't hear any, so no aorta, renal, iliac, or femoral bruits are present. We're gonna listen to your bowel sounds, okay?
Okay.
Alright, your bowel sounds are normal active, present in all 4 quadrants. Alright, and I'm just gonna do some percussion, so all you need to do is sit. Alright, and they're all tympanic, no dullness, so no concern there. And no tenderness, right? Correct?
Right.
I don't feel any masses or anything like that, so that's wonderful. Alright, I'm gonna have you come sit back in the chair for me whenever you're ready.
Okay.
You can just sit back in the chair, just
Okay.
normal, if you don't mind. Alrighty. Alright, and no tenderness ever in your joints or your blood vessels?
Nope.
Alrighty, your hands look good. I don't see any swelling, any signs of arthritis or anything like that, correct?
That's right.
Alright, do your hands like this for me. And roll your wrists around. Any tenderness, swelling there? Alrighty, perfect, perfect. Alrighty, Alrighty, and I'm just gonna look at them again just to make sure we don't have any redness. I don't see any redness or swelling. Do you like this one more time for me? No crepitus is present. Oh, normal findings, wonderful. Alright, and then I'm gonna take a look at your fingernails here. Alright, and cap refill is less than 2 seconds. Very appropriate. That looks wonderful. I'm just gonna take a feel right here. Radial pulse is strong. It's at 2+ and present. I'd say all the upper extremities are warm, appropriate skin color, and no edema is present. Do you have any other issues right now, current health problems right now that would affect that?
No.
Alright, and then I'm gonna have you do, we're gonna do this again. I'm gonna have you do like this, range of motion of all your fingers. Alright, and lift all your fingers up. Alright, and touch like this. Okay. Like you're grabbing something. Perfect. So all the fingers, flexion, extension, hyperextension, abduction, and adduction. Can you do like this for me? And we're gonna pull them back. Alright, and then we'll do them against each other. And then like this. Wonderful. Looks great. Alright, and then I'm going to have you grab my hands and just squeeze for me, okay? Alright, strong grip. Very appropriate. 5 out of 5 strength. The wrist didn't have any redness, swelling, deformity, nodules. Crepitus, the wrist looks symmetrical to me. Yeah, put your hands out like this for me. Perfect, they look very symmetrical. Good. Okay. Any pain or swelling in your wrists ever?
No.
Alright. Alright, and can you roll your sweater up? We're just going to take a look at your elbows just for just a second. Alright. They look very perfect. Alright, I'm going to have you go like this. And then like we're curling. Alright, and then if you would, just stand up just for a second. And see as close as you can touch, just like this.
With both hands?
Yeah.
Oh, goodness.
Oh, wonderful. That's good. Alright, and switch arms. Good job, good job. You can sit back down. No redness, swelling, deformities, tenderness, crepitus, or pain in the elbows. Alright, and then I'm going to press on your hands, and I just want you to press up. Good. Alright, and now press down. Good job. Good job. Alright, and then we'll just take a look at your shoulders once more, and they look good, very appropriate. No swelling, tenderness, masses. Skin looks appropriate, and I'm going to have you press up one more time for me.
Okay.
Good job, very strong, good. Alright, and then I'm going to have you do like this. I'm going to have you raise one arm, alright, and put it down, and raise the other arm, put it down, across, and across. Alright, and give yourself a hug.
Okay.
Wonderful. Alright, and then I'm going to have you just stand up for just a second.
Okay.
Alright, go ahead and stand up. And then I'm going to have you swing your shoulders, kind of like you're swimming.
Sure.
Back stroking. Alright, and then forward. Alrighty, wonderful. And then I'm just going to have you continue to stand just for a second. Alright, I'm going to have you close your eyes for a minute, and you just tell me where you feel a soft touch at.
On my right upper arm. On my left lower arm.
Okay.
On my back right upper arm.
Alright, wonderful. Okay, and I'm just going to listen to the owner. artery. And I don't feel any sensation here. Okay, and you can just sit back down for me.
All right, thank you.
All right, Miss Paige, I'm gonna have you close your eyes, and I'm gonna place some items in your hands. And if you could just identify those items for me.
All right.
Close your eyes, please.
Flashlight.
All right, take that back. Place your left hand out for me.
Set of keys.
Perfect. All right, and place your right hand back out again.
A pen.
Wonderful. And keep your eyes closed. I'm gonna trace something on your hand, and you just tell me what it is.
Okay.
I'll do it one more time.
The letter 3?
Yes.
Great.
All right, and I'm gonna do your other hand as well.
The number 2.
Perfect. All right, then I'm gonna have you stand up one more time.
Okay.
And we did do the hand flip flop, so just do like this for me.
Okay.
And then do this again. Wonderful. And back to here, kind of to a praying position. And then I'm gonna have you like this. Finger, finger, finger. Touch each finger one time. There you go. Wonderful. Alrighty. And then I'm just gonna have you continue to stand really quick. And I'm gonna assess some deep tendon reflexes. You could just put your arm out for me. Nothing. I'm sorry, that's something. All right, and our brachioradialis is our biceps reflex was appropriate. We're gonna do the brachioradialis. Just take one step back for me.
All
Thank
right.
you. There we go. We'll redo that. All right. Just kind of twitch. Perfect. Perfect. All right, and then we're gonna do. I'm gonna do the triceps and flip your elbow over. All right, and you can go ahead and sit down for me. All right, and we're just gonna check the patellar reflex. You just sit up for me. Perfect. All right. Perfect. I'm gonna do the Achilles. Wonderful. And then I'm just gonna check the Babinski side here, and I'm gonna put my hand up the foot, and I see toes flaring. Perfect. I'm sorry, I see toes curling in. All right. I'm just gonna go ahead and remove this one shoe for me.
Okay.
Thank you. Turn our table just a little bit. All right, and I'm looking and inspecting the toes here. I don't see any redness, swelling, deformities. You got any tenderness down here?
No.
No nodules, no crepitus.
No.
And I'm gonna take your other shoe off as well, if you don't mind. All right, and then feet and toes are symmetrical. All right, and I'm gonna check the cap refills. Less than 2 seconds, wonderful. All right, and I'm gonna have you flex your toes back, bring them back here. All right, and point them down. All right, and to the side, and can you curl them in? All right, and then fan them out. All right, perfect. The toes and the feet are warm. The color is appropriate to ethnicity. No swelling, deformities, tenderness, nodules. Move your foot, ankle up and down. No crepitus. They're all very symmetric. Alrighty. Yep, and then I'm gonna have you just circle with them, just kind of like how we did with the wrist. Wonderful. I'm gonna hear some slight crepitus on that one. All right, and then I'm gonna have you press down with both feet like you're driving the gas pedal. Good, and then pull them back to your nose. All right, perfect. You can let them down now.
Okay.
I would give those a 5 out of 5 strength. I'm gonna inspect and palpate the knees. I don't feel any nodules, swelling, deformity. Do you have any pain or tenderness in this area ever?
No.
Alrighty. Oh, very appropriate. No nodules. Alright. And then flex your knees. So kind of do like this. Kick them up.
Gotcha.
Alright. And then pull them, keep them up. And then pull them down against me. There we go. Perfect, perfect, perfect. Alright, and then I'm going to have you, we're going to pull your legs out.
Okay.
There we go. And then I'm going to put my hands here and then push them in. Perfect, good. 5 out of 5 strength there as well. Alright, and then I'm going to have you close your eyes one more time and you just tell me where I'm touching at.
My front left top foot. My right foot on the side.
Okay, and I'm going to assess the medial malleolus, and I don't feel any vibrations here. Any tenderness here
No.
or here?
No.
Okay. All right, I'm going to have you stand up again.
Okay.
All right, and I'm going to just feel our hip bones here, and they feel appropriate. No redness, swelling, any pain or tenderness there?
No.
All right, they look symmetrical to me. And then I'm just gonna have you do your legs kind of like this.
Okay.
Wonderful. Do the other one kind of like we're doing ballet. Wonderful. And then kick them up and back. Oops. There you go. And then back with the other one. All right, wonderful. And then I'm gonna have you do the same thing with your knee while we're standing up.
Okay.
Out and back and around. All right, and out with other foot. Back and around without hitting the table. Wonderful. Wonderful. I'm going to leave you standing up if that's okay with you, Miss Paige.
Sure.
All right, and I'm just going to turn you this way. We're just going to palpate the spine. Curvatures are expected. Alignment is down the middle. I don't notice any scoliosis. Any tenderness in your spine or your back there?
No.
Alrighty, and then I'm going to have you do this for me, okay? I'm going to have you bend forward.
Okay.
Okay, go ahead.
All right.
That's good. And come up. And then kind of bend backward like this.
Okay.
Good job. Wow. So extension, hyperextension are in check. And then I'm going to have you to the side, to this other side, and then rotate like we're popping our back almost.
Okay.
All right, and then I'm going to have you keep your eyes closed and put your hands out. Okay, and then I'm just going to do this for about 10 seconds. We're testing the Rombergs here. I don't notice any swaying, so that's the expected sign. All right, and then I'm going to have you start here. You can open your eyes now. Start here.
Okay.
And I'm going to have you walk toe to toe, just like this.
Okay.
And just walk to about the end of that chair for me.
All right.
And then I'm going to have you turn around and just walk normal like you would all the time.
Okay.
All right, and then I'm going to have you just do one hop in place for me?
Sure.
Wonderful.
Okay.
And we're just about done, Miss Paige.
All right. You've been great.
I'm going to have you hop on one foot if you're able to do so.
Okay.
Just very gently. And then the other foot. Perfect. All right, I'm going to have you sit down. All right, and are there any other things that we need to discuss today while you're here in the office? Any other more concerns that you've got?
I don't think so.
All right, well, your checkup went wonderful.
Thank you.
And I think you're good to go home, and you call us if you have any concerns or anything new arise.
Okay, I certainly will.
Okay. All right, Miss Paige, you have a wonderful day.
Thank you, Miss Paige.
Thanks.